Welcome back. The hospital industry agreed today to help President Obama's plan to overhaul U.S. health care by cutting $155 billion in costs over the next 10 years. The president's trying to reduce health care costs and expand insurance to the 46 million estimated Americans without coverage. Republicans have objected to the cost, which may top $1 trillion. David Brailer is among the GOP critics questioning the details of the legislation. He was the first national coordinator for healthcare information technology appointed by President Bush. He's now the chairman of Health Evolution Partners, and he joins us now from our San Francisco newsroom. Mr. Brailer, welcome to Bloomberg News.
It's good to be with you, Mark.
Mr. Brailer, that $115 billion cost savings move that I just spoke of, does that insulate the hospital industry from risk?
Well, I think it's clear that there was a quid pro quo where the hospitals give up some long-term cost growth in exchange for getting certain guarantees, including that the unfunded care, the charity care that they do, does get paid for by the government. So it works out for both sides, and they would be insulated from future cuts under that deal that was made.
The debate over health care, has it become too politicized? The fact of the matter is that number that I gave was a rough estimate. It's actually between 45 and 50 million of our fellow Americans who don't have health insurance, and most of those are the poorest among us. Has the debate become too politicized? Have we lost focus?
Well, look, I don't think you can talk about reforming a $2.2 trillion sector of our economy without a significant amount of politics, both kind of partisan politics, but also the politics of the views that people have. But I think what's happening here is that Washington always starts talking about how we're going to fix the way care is delivered, the way each of us gets treated, the kinds of medicines, the kind of options we have, and always retreats back really quickly to how it's paid for. And in doing so, they've left some of the biggest pools of cost savings on the table. And I think that's going to be one of the real questions. And they include, how do we reduce the rate of medical errors and accidents? This costs the industry well over $100 billion per year. That's wasteful money.
Well, you say that,
how do we deal with
that in the stimulus bill, there's basically $20 billion to do that, correct?
There is some money that's put towards improving quality and safety, but the fact remains today that if a hospital makes a mistake, if somebody comes in for one treatment and they get a complication or something goes wrong, the hospital makes more money off of that more complicated patient. The incentives are wrong in the industry, and the incentives are there to do more for patients even if they don't need it. And until we address the fundamental incentives, that $20 billion will go nowhere.
Well, how do we address that? What needs to be done? What's David Brailer's solution? What's the Republican plan?
Yeah, I can't say that I speak for the Republicans. I think I speak for a group of people who certainly are looking for a more market-based solution. And let's look. Across the United States, we have dozens and dozens of experiments underway today with how to pay doctors and hospitals for the quality of care they deliver, not for the volume of services. Today, the more patients that are in beds in a hospital, the more money they make. The more procedures a doctor does, the more money he makes. Under a pay-for-quality solution, if a doctor improves your life expectancy, improves your ability to get back to work, they get paid more, and if they don't, they have to pay for it. And these projects are ready to scale across the nation, but they're not on the table today because we're dealing with how to cut the prices of health care. And so what the hospitals gave up were price increases, Medicare changing the reimbursement a little less aggressively over time. That doesn't change what happens, and that's the question that's going to be left.
Well, as you know, the debate on the Democratic side has been about whether to include that so-called public option insurance plan similar to Medicare in this year's bill. Republicans think the public plan would hurt private insurers. What do you believe would happen if that public option is passed? Would those effects be good or bad for regular patients?
Well, sure. I think, the health insurance companies can certainly fend for themselves, and if the public option is passed, it'll change the insurance market. But what matters is whether or not it actually improves patient care, whether or not you can get treatments you didn't before, whether or not someone that doesn't have insurance can get it. And it's not been demonstrated to be effective. There are numerous government programs today that provide coverage for people that are not adequately used. If you look across the states, it's the same thing. I think it becomes a proxy in the discussions for something bigger, which is the government wanting to have leverage over the long-term price structure of the industry to be able to avoid the kinds of run-ups we've seen in prices over the past. I don't think the public option is needed to achieve that.
And Mr. Brailer, I'm sure you've heard the argument, why isn't our system like the Canadian system? What do you say to that?
Well, I would say thank goodness it's not. I mean, it's, you know, people in Canada wait for a very long time. Canada has a number of people in their population every year who progress from a cancer being detected to dying of it while they're waiting on treatments. That would never be considered acceptable in the United States. If you're an older person and you fractured your hip, you could wait for months, if not a year, to have a hip replacement. That's not the kind of healthcare system we want to have, even though I think there are many desirable attributes about the Canadian system.
And Mr. Brailer, we have about 15 seconds left. I guess the goal here, everyone in the country, every American citizen should have the same healthcare plan their member of Congress has?
We certainly want to have everyone have at least a minimum health insurance plan, and if people want to have more than that, they could buy it. But everyone's got to be covered at the base.
David Brailer, chairman of Health Evolution Partners, joining us from San Francisco. Mr. Brailer, thanks.